So I'll be sharing with you in this video what every medical virtual assistant must know about the EMR and your work as a medical virtual assistant in the EMR system. Hi, my name is Judith, a registered nurse and a medical virtual assistant. If you are new to this channel, I welcome you, and on this channel, I share practical tips and guides to help you become the best medVA you can be out there, and please do well to subscribe. And to all of my returning subscribers, thank you for coming back. So after this video, I want you to know that the EMR system is simply the digital version of the patient's paper charts, where all the patient's notes, diagnosis, medications, and the treatment plans of the patients are stored. But this time around, they are stored securely in a computer. And it simply helps clinics and providers document, track, and monitor patients' care more efficiently. So I know that you often hear about the EMR and the EHR, and sometimes you wonder what is really the difference between them. So the EMR system is the electronic medical records and is designed to be used within one clinic or practice, while the EHR system is the electronic health records, which goes beyond that and is designed to be shared across multiple facilities. So in a simple term, every EHR is an EMR system, while not every EMR system is an EHR system. I don't know if that makes sense. So that is why people mostly use them interchangeably. So as a medical virtual assistant, you might handle both depending on your client's system. So let me share with you some of the EMR systems we have out there. So there are many EMR systems out there, and each one has its own design and workflow. We have the Open EMR. So when I started learning about the EMR system, I started practicing with the Open EMR because I didn't really know that they have other EMR systems with free trials. So I started with Open EMR because you can just easily log in and practice. It's actually very easy to use, and whenever you want to use it, you can always use it. There are no restrictions to using the Open EMR. Also, we have Dr. Chrono EMR system. So the Dr. Chrono EMR system is a bit more complicated than the Open EMR. Like, I remember when I logged into the EMR system the first time, I was really confused. But then after consistent use and trainings, I got to understand the EMR better. And also, it has a 30 days free trial, and you can check that out. We have the Simple Practice EMR system. The Simple Practice EMR system is really very simple to use, and you can check that out as well. We also have Optimantra. We also have Cario, Senna, Epic, and the rest of them. There are just so many EMR systems out there. As much as most clinics, they will train you on their EMR systems when you start working for them, it's very important for you to know at least one or two EMR systems, master them correctly so that you can be able to adapt to any EMR system. Because when you are able to understand the workflow of one or two EMR systems and how they work, there is no EMR system that you cannot figure out, or there is no training that can be given to you that you cannot adapt easily. Now let's look at your role as a medical virtual assistant in the EMR. But then before I continue, please, if you have watched up to this point, please like this video so that it will reach to a greater number of people. Hit on that subscribe button so that it will encourage me to drop videos every week, and so that you don't miss any medVA content from this channel. So as a medical virtual assistant, your role in the EMR system often includes creating new patients, entering patients' data in the EMR, scheduling appointments, obviously, documenting and updating the provider's notes, updating records after each visit, creating super bills after the patient's visit, uploading lab results, and you also get to handle medical billing in the EMR system, depending on the clinic and depending on the EMR system that is being used in your clinic. So basically, you are the digital backbone that keeps the patient's record organized and accurate. So the earlier you learn how to navigate the EMR system, the faster you grow in this role, because it will show clients that you understand healthcare workflow, privacy, and compliance. So you don't just want to memorize the EMR system, you also want to practice it on your own. So I would advise that before you get that hands-on simulation training or that training that you want to on your own start practicing the EMR system. Start learning it on your own. Start using what you have been learning to build your portfolio, no matter how imperfect it is, so that when you finally get a formal training, you only have to build onto what you already know. So from my next video, I'll be sharing different features in the EMR system, and I know you wouldn't want to miss that. So if this video helps you understand the EMR systems better, please give it a thumbs up so that it will reach to a greater number of people. And if you want to become a very confident medical virtual assistant, please hit on that subscribe button so that you don't miss any hands-on tutorial from this channel. And also comment on the EMR system you would want me to do tutorial on in my next video. Thank you for watching and see you in my next video. Bye.